This is your Unit 4.4 review for PVS heart interventions. We've learned that Anna Garcia has a history of heart disease, but we really need to understand how this might have contributed to her death. We're going to use this term called heart disease. It's a broad term, and it describes what's going on in your heart that is abnormal. It could be diseases of blood vessels, it could be rhythms that are off in your heart, it could be infections, some sort of bacteria infection in your heart, or you could be born, congenital heart defects, born with it. We're going to talk about how these different deformations can be treated and even prevented with certain lifestyle modifications, surgeries, procedures. So follow along with me as we talk about unblocking the vessels. We're going to cover three main ways that doctors unblock vessels: angioplasties, stenting, and coronary artery bypass. Let's cover the basis of heart disease. What is it and why is it bad? It's whenever your heart is damaged, and that is damaged because of the function and the circulation of the blood is no longer able to do its job. When does it get damaged? Whenever you have a blockage of plaque and buildup in the arteries. This also can lead to heart attacks because the front of the heart, that coronary artery that runs down the front of the heart to supply oxygen-rich blood to all the cells of the heart, there's a lack of that oxygen, therefore the heart attacks occur because the muscle itself is dying. Here's a picture of a heart. The arrow points to the side of the heart where you can see a heart attack. It shows that the muscle has died because there was not enough oxygen to the heart. Normally the whole entire heart would look pink, but you can notice here where the arrows are pointing that it's almost like a light yellow colored. Plaque buildup. We learned about atherosclerosis in class. It's whenever plaque builds up in arteries and forms this little hardened area that restricts blood flow. We call that restriction a blockage or an occlusion, OCCO occlusion. This is because you have extra cholesterol because of your diet, your lifestyle, maybe even genetically. You have a buildup of extra cholesterol. That LDL cholesterol has built up and caused plaque. This also can affect your brain. If you have a clot that forms in the arteries that's taking oxygen to your brain, you can have a stroke, and you could suffer from a stroke because of the lack of oxygen to your brain. Lack of oxygen to your heart is whenever you have a heart attack because the tissue is dying. If you get this buildup of plaque in your legs, the arteries that run down your legs, this is called peripheral artery disease. Peripheral meaning the extremities, the arms and the legs, and the arteries in those extremities are the ones that are suffering, that have the main plaque buildup. Why is peripheral artery disease a bad thing, and why is it important to understand? Because doctors often use the femoral artery, or the arteries that are in the leg, to go up through in order to insert cardiac catheters. Catheter is another term for a tube that they can put a camera or dye or some sort of instrument in to help fix things in your heart. It seems silly that they go in through your groin muscle or the inside of your leg and the inside of your thigh, that they'd stick a tube there up into your heart, but it actually leads right into your heart. You can kind of tell with this picture here. The femoral artery, they go in, they go all the way up to your aorta, down through the blocked coronary artery, and fix the things in there. Doctors will also use this artery to diagnose blocked vessels. Angiograms, kind of like a telegram, is a message. An angiogram is a message we get back from an x-ray. A doctor will actually go in through the femoral artery, inject radioactive dye, that's dye that will glow underneath the x-ray, and it'll actually show us where there's a pinch, an occlusion, a blockage in whatever artery or vein. We can figure out what percentage that artery is blocked out of 100%, meaning completely closed, or 1%, meaning not that bad. And the doctor will go in and actually diagnose what needs to be done. The first thing the doctors will do is, if the artery is occluded or closed to a certain percent, they will try a balloon angioplasty first. So they've got a catheter, a tube up in there, and now in the tube they have a balloon. And the balloon, just like a balloon you see at birthday parties, you blow it up, it gets bigger, you release the air, it gets smaller. A balloon is actually inserted in the catheter, and it's blown up to expand the artery just enough, not to make the artery burst, but enough to push out the plaque. It actually busts the plaque up and allows that plaque to go down into your system and hopefully be digested, absorbed. Maybe that HDL can go in there and help tear it down and take it where it needs to go. Now, if an angioplasty is done and the diet doesn't change, the lifestyle doesn't change, or maybe that plaque finds another place that it stops and clogs up, the next step is to try a stent. A stent uses the basis of an angioplasty. The wire mesh is used still, the balloon is used still, but they wrap a wire mesh around the balloon. So when the balloon is inserted and blown up and then deflated and pulled out, it leaves behind the wire mesh that was wrapped around the balloon. This wire mesh is kind of like a tunnel. It's trying to hold open the vessel so that way future plaque doesn't cause it to become occluded. That way the blood can flow through normally. It's supposed to allow the proper blood flow to occur. So the stent is the actual wire mesh portion. The angioplasty is the balloon, and the catheter is the tube that they run up your leg. Stents will stay in as long as they do. Sometimes if you need to be repaired, sometimes they'll have to do another stent further down in the artery. Just depends. You can have multiple stents in your heart, in your artery as well. Here's another close-up of an angioplasty for you. It shows that balloon being blown up. It shows on the left the plaque, the narrowed artery on the right. It shows how it's widened. It just basically pushes it to the side. Here's a better picture of stenting. You can see the angiogram results in the top right-hand corner. It shows where the little artery is pinched, and then on the right, you can see the kind of the wire mesh there. It's like a tube or a tunnel, an opening. It's a channel that holds it open as it's expanded. It stays in, but the balloon is pulled out. Now, if those two things don't work, the next and final last resort is a CABG, or a coronary artery bypass graft surgery. It's whenever a vessel, a healthy vessel that's in your leg, they usually pull from the leg because they already know that it's same type of tissue, pretty good size. They will go in there and dissect a piece of your vessel. They'll take it out of your own body usually. Sometimes they get it from donors or cadavers, but they'll take that vessel and they will actually go in and transplant it into your heart. It's best if they use your own tissues so that your body doesn't reject it and whatnot. If you've ever drove on the highway and you've taken a bypass, that's whenever the highway, you can go straight, but instead you're going to go around and bypass the traffic or bypass the area. And so a coronary artery bypass is when the coronary artery is blocked and we're bypassing the blockage. So the blockage is so bad that going in there and trying to fix it could cause the person to die, or we've already stented it, we've already done an angioplasty, it's not working. So they'll make you a new artery. They'll bypass the blockage with the new artery that was from your leg. This is usually reserved for really, really extreme cases. You've probably heard, if you've ever watched a medical show, they've got a triple bypass surgery. Well, take a look at this picture. It shows the difference between a single, a double, and a triple bypass. A single bypass is when they've only had to bypass the coronary artery once. A double is in 2 different places it's blocked, and a triple is whenever there's 3 places coming off of the aorta or coronary artery that is currently blocked. So obviously a triple bypass is a lot worse than a single or a double. So what is going to cause you to have a risk of having to get one of these procedures done? Well, there's certain conditions that put people at greater risks. There's some things that you can kind of account for and change, lifestyle, eating, things like that. But then there's other serious risks that you can't really do anything about. They're just kind of genetic. So let's talk about modifiable and non-modifiable. To modify something means to change. So things that are modifiable are changeable. You can change your smoking. You can quit smoking. Or just never do it. How about that? You can eat a diet that has better fats instead of the kind that clog your artery, and behaviors that you can choose to end. So choosing to stop things that you shouldn't be doing, like eating diets in high saturated fat, or just not doing things like smoking. Those are things that can be affected by your lifestyle. Things you can't really change, non-modifiable, family history of your disease, so if it runs in your family. For example, if you have the FH mutation, high cholesterol, it puts you at a higher risk. Certain races are more at risk. Gender, females versus males. Those are things that we can't really change. We can't change our family history, we can't change the color of our skin, or what gender we are, theoretically. Now, because you have no control over these, you can still try to lead a healthy lifestyle, but the more risk factors you have for a particular disease, the greater chance you are to get the disease. That brings me to the metabolic syndrome. You're going to need to do some research in this activity to figure out what metabolic syndrome is. take a look over these risk factors. We've talked about them. Obesity is whenever you are overweight and your body mass index is higher than it should be at your height and your age and your weight. Triglycerides, so saturated fats, your HDL and your LDL, how those things combine. And blood pressure risks. Those are the three big ones that doctors ask about, but smoking, diabetes, family history, blood sugar, and cholesterol, those things right there also take into fact. The metabolic syndrome is whenever you are at risk for 3 or more of these things. So if you can check on a little survey, do you smoke? Do you have diabetes? Do you have a family history of heart disease? Those are the things when you go to the doctor and your check mark, you're like, why do I need to do this? They're checking to see if you have 3 or more risks, which would put you in a category of saying you have a metabolic syndrome. How can you decrease your risks? Simple. Exercise, diet. There are some medications like statins we learned about. Quit smoking, maintain a healthy diet and weight. So if you have a risk factor, there's some preventions you can do. Like hypertension, high blood pressure. Get checked regularly. Avoid foods with high cholesterol. Make sure you're treating your diabetes. Try to avoid overeating, working out. Exercise more, and relaxation. Stress is also a factor for these type of diseases. In addition to buildup of plaque causing certain diseases to occur, there are also some internal heart malfunctions, things that are going on inside the heart that you might be born with that you can't really help. So let's look at these. There's something called left ventricle hypertrophy, aka large heart, an enlarged heart. We talked about the word hypertrophy. So this is whenever the left ventricle is having to work really hard and it becomes really thick. This is caused, not that you're born with, well, you can be, but usually it's because you have high blood pressure, or you're obese, your lifestyle is not that great. It causes your heart to work harder than it needs to, and that can lead to heart attacks, abnormal rhythms, and your heart to fail. All right, let's talk about some valve problems that are pretty common in young adults and teens like you, but goes undiagnosed for many reasons. Mitral valve prolapse is whenever the valve of the mitral, right between the left atrium and the left ventricle, doesn't close properly and allows the blood to flow backwards, back into the left atrium. It should go from the left atrium to the left ventricle and then out the aorta, but it doesn't close properly. And what can happen is that tissue can get infected and you can get endocarditis. Endocarditis or carditis is whenever the inside of your heart is inflamed. It can cause your heart to sound like it's murmuring. You've probably heard of a heart murmur. You've heard people say that before. Some of you might even have heart murmurs. Mitral valve prolapse is very common. It's not critical. It doesn't usually cause you to die or whatnot from it, but a lot of people go undiagnosed because you can live everyday life with this. It just can lead to problems that are more serious. For example, rheumatoid fever, inflammation that can affect the joints and the heart. So you get this fever that goes throughout your joints and hearts, all different inside of you, causes you to feel sick. Sometimes it sounds like a murmur, like a click-click sound. Teens with the MVP can feel dizzy, lightheaded, fatigue, that's tired, shortness of breath whenever they're exercising or playing sports. It almost feels like your heart's skipping a beat or your heart's being really rushed. Heart pain comes and goes, and sometimes they describe it as sharp from person to person. It's never really clear if it's actually MVP. How do you diagnose it? You basically listen to your heart, and the doctor has to catch it right at the time that it prolapses. It doesn't do it on every beat, so that's why it's really hard to catch and goes undiagnosed. Just kind of watch for these symptoms in yourself, and also if you're given an example on a test or quiz to try to diagnose it, and you see that word teen, or you say that someone's pretty young and they're talking about an issue with their heart, young people don't usually die from heart attacks or strokes. It's more likely that they have some sort of valve prolapse problem going on. How do we fix these irregular rhythms? Well, you've heard of a pacemaker. Pacemaker is inserted. It's a little metal box. It helps shock your heart whenever your heart is off pace because of your SA node. If you'd like to do some further research on these topics, I have a couple websites here for you. And then you can look at the rest of the slides on your own about heart disease and technology. There's some pretty awesome pictures of what's being used nowadays in order to diagnose and treat different heart conditions. Take a look through these. If you have any questions in class, go ahead and ask me, and enjoy the lesson that we're going to do.